this is your girl, Kenya Brown, and welcome to Black Health 365. Now, February is Black History Month and American Heart Month, a time to celebrate our community and talk about health issues that affect us the most. One of those issues is high blood pressure, often called the silent killer because many people have it and don't even know it. There are always warning signs, but it can lead to serious problems like stroke, heart attack, kidney failure, and brain aneurysms. Joining us now to help break down this talk about what we can do to stay healthy is one of my faves, Dr. Gregory Hall, a primary care doctor and medical director at the Cutler Center for Men at University Hospitals. Hi, Dr. Hall.
How are you doing?
I'm doing well. I love our conversations, and we get to get a lot of information out here to so many people. So I'm excited.
Excellent, excellent. I'm ready.
All right, so let's talk about it. Let's talk about high blood pressure or hypertension. Uh, let's talk about it. What is it?
Well, it hits a lot of people. I'm actually surprised when I see some patients that are Black that don't have it, to be honest with you. I have hypertension. My wife has it. My brothers, my sister does it. But it hits a lot of people in the community, and it's very prevalent. And then high blood pressure leads to heart attack, stroke, all the things you listed. And as much as I try to be healthy and try to avoid getting hypertension, I got it anyway, right? And so I share that with my patients to kind of demystify the whole thing. But high blood pressure, when the pressure in your vessels is too high for your vessels to sustain. And over a prolonged period of time, that high pressure can cause the vessels to burst, and that would cause a rupture in the brain, could cause a stroke, or it just can cause a hardening of the vessels over time. And you've heard hardening of the arteries. It can
Yes.
cause a problem with clots breaking off in your heart, and also an increase in the thickness of the wall of the heart. So everyone should have a low blood pressure. So people ask me, how low? Well, as low as, and you're not lightheaded, right? So again, my sister who doesn't have hypertension, her blood pressure used to be 90/60. She felt fine. Is that too low? No, that's fine. As long as you feel good, low is good. Low is always better.
Okay, so we want low, we don't want high. Now, what's our healthy number? Where should we be at?
Well, in general, we want to be less than 120 over less than 80. Like when I check my blood pressure, I want to see 117/68. Like officially years ago, we would say less than 140 over less than 90 is acceptable, right? But now we see that even people with 135s over 85s are still at increased risk for having problems. And so we pushed it down lower, but lower is better. I always get these people that say, well, it's good for me. 144/92 is good for me. No,
Right.
it's not good for you. It is not good for you, right? 155, it's normally 200/110. That's not good for you, right? It's a terrible strain on your system. And that's what's causing, these problems. And so we talk about younger people having high blood pressure. A third of men in their 30s have Black men in their 30s have hypertension. And so when someone has out of the so-called clear blue sky has a stroke at 50,
Yes.
48, oh my God, he had a stroke, he had a heart attack, he was fine. He was really not fine. He had
Right.
20 years of uncontrolled hypertension that he didn't know because he never checked his blood pressure, and he didn't go to the doctor because no one wants to go to the doctor, right? And so we need to be able to identify the people with high blood pressure and catch them before these fatal or catastrophic events occur in their late 40s and early 50s. And it seems like it's the clear blue sky, but we're here, you and I are here today to say it's not the clear blue sky. Check your blood pressure, buy one of those monitors and check your blood pressure and see what it is, because even these young, healthy looking men and women can have high blood pressure.
Yes, have one in your house. You can pick one up at the store, at the pharmacy, anything. It never hurts to be able to throw that thing on your arm or whatever it is and check your blood pressure because you might be surprised that you might need a little attention there. Now, I know you mentioned some people say, okay, well, I'm good at this number or that number is so there is no safe number really over that threshold, that 120/80 type situation.
Yeah, no, there really isn't. There's no acceptable. I think when people get a certain age, much older even than me, they sometimes they'll make you have an elevated blood pressure just to keep your arteries open. You know what I mean? But that's
Yes.
pretty much older people. But generally, after people have a heart attack or after they have open heart surgery, then they really bring their blood pressure down. And so it's like, why we could have done that before you had that event and change your life upside down and done it at that point. The high blood pressure also really injures your kidneys. And so that's why there's so much increase, people on dialysis in our community, because that high blood pressure can really damage the kidneys and accelerate, really age of the kidneys. And that's a big thing. So a lot of people, if you're not afraid of a heart attack or a stroke, you might want to be afraid of having to go on dialysis.
I did not know that. That I did not know there was a connection between like your kidneys and the blood pressure. I thought I had to do something else wrong to mess up my kidneys.
No, no. Usually it's the blood pressure. Now, diabetes can also cause problems with the kidneys, and so we see that in the Black community as well, because we have a high risk for diabetes. But high blood pressure is usually what does salt. So then we got salt driving high blood pressure, and the high blood pressure destroying the kidney, the insides of the kidneys, and that's all hypertension driven.
Yes. So make sure you share this video, guys, because it affects so many of our households and you could literally save a life. Now, what are some of the symptoms we should be looking for with high blood pressure?
And this is the thing I always end up arguing with my patients about. I feel fine. Well, of course you do, because hypertension is what? The silent killer. It's the silent. You don't know until something catastrophic, till you go to the hospital. Now I'm on dialysis. What happened? I having a heart attack. I can't believe it, because it's the silent killer. And so people don't sense that their blood pressure is high. Some people say, "Oh, you're driving my blood pressure." Well, if you're stressed, your blood pressure probably is up for that as well. But there's most people can't tell what their blood pressure is. I certainly have no sense of what my blood pressure was when it as it marched up, or from 20 years ago, and you can't tell. So it's not something you would look. But now, thanks to modern technology, you can tell by sticking your arm in a blood pressure monitor at your kitchen table and see what it is. Now you can tell.
What about like nerve pain? Do you feel like the nerve pain a little bit more when your blood pressure is high or
Well, I mean, what it can do, higher blood pressure can give you a headache. And so I've seen people with super high blood pressures will come in with a very bad headache, and then you check your blood pressures. Oh my God, that's why the pressure is going to your brain so much, it's giving you a headache. But do not wait to feel something in order to decide whether you have high blood pressure or not. It's just,
yes.
in so many people, they just don't know.
Yes, so get those you need to know those numbers. That's so important for you is know what you are working with. Now, who is at most risk for high blood pressure?
Really anyone, to be honest with you. And of course, the fruit doesn't fall far from the tree. So if your mother and your father and your brothers and your sisters all have high blood pressure, odds are you're going to get it. And so that's certainly what happened with me, with my father and brothers. And so you would certainly look for it more so in people like that. But the easiest thing is just to measure it. There's certainly people who put a lot of salt. He went up to dinner and this guy started loading the salt on his steak, and I was like, my God, I wonder what his blood pressure is. So if you use a lot of salt or eat a lot of salty things, like big corned beef. We're in Cleveland, big corned beef fan. You probably are going to have high blood pressure earlier than anybody else.
That sounds good, Dr. Hall. The nice corned beef. Okay. We'll talk about that another time.
Yeah,
All right.
and yeah, that's right. March, right?
Yes, yes, yes. Okay. So, why is high blood pressure affecting the Black community so much?
Well, it's a long explanation, but the easy answer is a lot of it's is salt, and some of it is some vitamin deficiencies. Vitamin D deficiency is associated with an increased risk for diabetes and hypertension, and practically everybody Black in Cleveland has vitamin D deficiency. But the bigger thing is probably salt, processed foods, fast foods, French fries, hamburgers, all that stuff, that the red meat does it. And so people don't eat enough fruits and vegetables and nuts. And so our diet contributes. A lot of us don't have good diets, and we don't like vegetables, don't eat fruit. That drives your blood pressure up. And so, correcting those little lifestyle things, exercising, walking, getting out of the house. Not You don't have to be strenuous, just kind of getting yourself going. Sweating is good for you in terms of cleaning out your system of toxins and whatnot. All those things can lead to an overall better health and overall lower blood pressure.
So if your parents had high blood pressure and you're eating the same way that you were eating when you were at home, it might be a problem. It might be something that you need to check out, revamp, something like that. So, how about how is high blood pressure treated? How do we treat it? How do we get rid of it?
Well, I
Can
mean,
we?
aside from the lifestyle modifications we have, once you get in front of me, I'm going to prescribe some medicine for you, right? Easy pills. There's pills that are very well tolerated. They're once a day. They don't have any side effects. You can take them. I take mine, right? Empty stomach, throw them in my mouth. I'm on cholesterol medicine too. I put both of them in my mouth and swallow them. And I don't think again about it. I mean, I don't eat till lunch. And so it's a once a day thing. It's easy. There's a lot of different approaches. There's a lot of different, since there's a lot of people with high blood pressure. There's a lot of different high blood pressure medicines. So you talk to your primary care doctor or your internist, and they'll be happy to start you on something that's well tolerated and that'll bring your blood pressure down.
All right. So, what can people do to prevent or at least better control their high blood pressure?
I think it's some of those things that we've sort of talked about already. I mean, really you should be walking 30 minutes, 3 to 4 days a week. 30 minutes, 3 to 4 days a week. That's a good practice. And get your heart going. You should be sweating 3 to 4 days a week. If you can't remember the last time you sweat, you need to go somewhere and sweat. I mean, and there's a lot of people who haven't sweat in a very long time, right? And so it's important to do that, to eat, to take your medicine if they prescribe it. Not have such a pushback on taking medicine. I mean, it's like if I say, "Oh my God, medicine," it doesn't take me 2 seconds a day out of my day to take my medicine and swallow it and keep going. That's all it takes. So it's really not that big a deal. I get it. My father didn't like have medicine. My brother don't like taking medicine. But again, my father had a stroke. My father had open heart surgery. My father had a lot of problems. And so hard head is not always the way to go, right? Just so I'm
Yeah.
doing just the opposite. I'm taking the medicine. I'm doing what my doctor says and trying to get the best advice out there.
Yes, take your medicine. You don't want things to slide on to worse outcomes and all of that. So make sure you know those numbers. You're trying to do things to eat right, and you can make some things taste pretty good, even with a little modification to it. So it's not impossible. It's something that you definitely can do. And I want you to share this video so that people can get this information. I'm so blessed to be able to talk to such wonderful physicians and doctors to get you guys information. And thank you so much, Dr. Hall, for joining us today and helping us better understand high blood pressure and why regular doctor visits matter. As we wrap up, I want to remind everyone listening, your health comes first. Don't wait until something feels wrong. Find a doctor you trust and stay on top of your health. Call 216-877-5912 today to schedule an appointment and to learn more about our Black Health 365 program. Visit wzakcleveland.com/BH365. Thanks so much, Dr. Hall.
Thanks for having me, and happy Black History Month.
That's right, y'all. Till next time.